Some years ago, I was fortunate to have been awarded one of the U.S. National Institutes of Health first exploratory research grant to study dance movement therapy as a complementary therapy. At first, I was terrified. What on earth was I doing with thousands of dollars worth of taxpayer money? Fortunately, also, I had wonderful advice and support, and I had dance movement therapy and the opportunity to explore and demonstrate the benefits of dance movement therapy for people with primary medical illness. What was then the Office of Alternative Medicine is now the National Center for Complementary and Integrative Health. Also at the time, dance movement therapy and the other creative arts therapies were categorized under mind-body control interventions. That phrase, mind-body control, is now more rarely used. It connoted a unidirectional relationship between the activities of the mind and the activities of the body, essentially a downstream kind of influence. We now know that the mind-body relationship is bidirectional, and that what we think of as body, the physiologic, chemical, neurological, and motoric, very much influences what we think of as mind, the cognitive, the emotional, personality, and behavior. And this is the understanding of the mind-body relationship that now predominates in integrative health arenas. It is also where the founders of dance movement therapy were well ahead in holistic health thinking. In fact, dance movement therapy is predicated on this idea of the bidirectionality of the mind-body relationship, and has been since its inception and professionalization here in the US in 1966. Patterns learned and insights gained through moving in connected and expressive ways in the context of a psychologically safe, therapeutic relationship can generalize into other areas of life. It was eloquently stated by an early theorist in dance movement therapy, Dr. Claire Schmace, and I quote, "Significant changes occur on the movement level that can affect total functioning." This, and it is often noted that the ADTA's definition of dance movement therapy emphasizes integration, another consistency with contemporary integrative healthcare thinking. In that study, a randomized controlled trial, I offered a brief course of dance movement therapy to adults and young adults hospitalized with exacerbations of cystic fibrosis, or CF. CF is a chronic and life-limiting illness that affects primarily digestive, respiratory or pulmonary, and sometimes reproductive functioning. Upon introduction to the study, one young man replied, "Oh, I get it. If there is no cure, we might as well work on healing." His spontaneous reply communicated his understanding of the mind-body relationship and of the role of services like dance movement therapy in a program of integrative healthcare. My treatment goals were psychosocial in nature, to provide a space for the expression of feelings about the illness and the hospitalization, to bring about a more positive attitude towards breathing, which in CF can be very difficult, and to provide an active rather than passive experience of the body and its capacity to take initiative. My overall aim was to humanize the hospitalization experience with a mind-body integrated psychosocial support service. My patients engaged in guided breath work, intended, as I mentioned, to make the experience of breathing more natural, pleasurable, and expansive. They engaged in guided relaxation with a dual emphasis on body and imagery. These components of the intervention were intended to enhance overall body awareness and interoception, or the internal sensing of the body. My patients engaged in expressive movement structures, which permitted communication about living with the illness, lifelong treatment processes, multiple medical procedures. They shared about their body images and about their inevitable deaths. They allowed themselves to use humor, to express anger, to express hope, to express both pride and gratitude for the health that they had that day. One significant finding from the study had to do with self-care, and self-care is recognized as a very important outcome in the management of chronic illness. Patients who participated in the dance movement therapy, and that was up to only 3 sessions, in 1 month follow-up reporting later, reported better self-care when it came to nutrition compared to those who did not participate in dance movement therapy. Why would this be so? I offer one possible explanation. Perhaps through participating in dance movement therapy, my patients became better able to listen to the body's messages, to attune to the body's sensations and needs, and thus perhaps valuing the body more, enabled better self-care and a motivation to take better care of the body more consistently. This may point to a mechanism of change in dance movement therapy and may have to do with self-efficacy. And I'm happy to share that subsequent dance movement therapy studies have suggested a similar relationship. Psychologist Ernest Rossi has suggested that mind-body processes can be accessed using breathwork, imagery, creative activity, and movement, including dance. Dance movement therapy combines all of these in a single intervention approach, and in that way may be unique among the mind-body services available to people coping with chronic illness, in distress, or pain or conflict. Researchers, thought leaders, and policy advocates in the US and abroad are working hard to transform healthcare into a more integrative system and offering more integrated care. Let's make dance movement therapy part of that transformation.